So the way we treat patients, or the process that we use, is called interdisciplinary care. What interdisciplinary care means is that Woody and I make teeth. We have a periodontist that does periodontal things. We have an orthodontist that does orthodontic things. We have an endodontist that does root canals. We have oral surgeons that are part of our team. And we have a team of guys that we've been training with and working with the same people since 1997. And our system of treatment has become very, very efficient and predictable. We sit with the patients, we determine the treatment alternatives, we have communication with the specialist when we need to before the patients even go to their office about what their particular conditions are. We share radiographs digitally, we share photographs, and when the patient leaves our practice and goes on to the specialist, they don't walk in the door and reintroduce their whole condition to the specialist. The specialist has been prompted by Woody and I of exactly what they have, what we've decided to do, and how that specialist, how that subcontractor plays in the whole role of their treatment.
We like to say we're the quarterback. We design, and the coach, really, we design the play, we design the case. We establish what the parameters and the end result need to be. We assemble the team of players that we feel will carry out the case the best. We then, with our information that we have assembled, we disseminate that information to all the team members involved. We collaborate on it together, and we monitor the progress of treatment throughout the course of the case. And as Joe said, we do it very, very efficiently. Our staff is highly trained, and they all know the processes so that we can carry out these cases with the utmost in predictability and efficiency.
They all know the people in the other offices. And so even though our office is in Davidsonville and other offices are in this regional area, all the people in the offices know each other. We all know each other. We've been working together for years. So it's just very coordinated and seamless. So a lot of times patients will say, well, can't you do the whole thing here? How could you possibly expect Woody and I to have the expertise of a gum specialist, a root canal specialist, an orthodontic specialist, oral surgeons? How could we possibly have all that knowledge and skill in our brains? We make teeth, we work with these guys, we coordinate it, and the cases just roll right through. It's not disjointed. I know in medical situations, you'll see your primary care doctor, they send you to the neurologist, you got to tell your whole story over again to the neurologist, and then you got to tell your whole story again to the orthopedic guy, and it doesn't work that way. We are behind the scenes connecting all the dots with our digital communication.
And therefore the predictability of the cases and the consistency of the cases and the efficiency, the timeliness of how it's carried through, and the comfort for the patient is made ever so great, so that in the end, the patient ends up with a result that was as seamless as possible to go through, and with the greatest amount of care that we can possibly give.
We just did a case this week with one of our surgical colleagues, and the patient came in the next day for a follow-up, and she said, it's obvious you guys have worked together for a long time and you enjoy working together. And we do. Our team members are not only our colleagues, but they're some of our best friends. We've done great things for patients together.
So we have a passion for the planning. We have a passion for our patients and to be able to deliver the best dental care possible. And through the processes that we've developed for many, many years, we're able to do this predictably, efficiently, and with great results.